This is the Working with Warriors podcast by the team at the Regional Men's Health Initiative.
Hello and welcome. I'm Owen Caddo, and today I'm joined by fellow team members Terry Melrose and Glenn Duncan. And how are you guys?
Well, thanks, Owen.
G'day, Owen. Good to be here, mate.
Look, we're carrying on today with our men's sexual wellbeing theme, and we've talked about the physical bits, and we've had our guest Ross talk about his personal experience, and today we really just want to talk about those other bits that are really important, and that's around testicular cancer, infertility, testosterone, and a little bit about STIs and just about the relationships that we need to have to maintain good sexual wellbeing, because, you know, we know that men are less likely to front up to the doctor about problems per se, health-wise, but when it comes to the prickly issues and around this, what we classify as men's sexual wellbeing, well, we don't talk about it and we don't confront, we put up with stuff, and that's detrimental to our wellbeing.
Yep, no, I think definitely discussing those issues below the belt, guys are a bit hesitant, unsure, and I think it does come back to all those things we talk about, blokes, where we're not as good at verbalising and talking, that ability to put the hand up, and then I don't think there's still that encouragement and safe places for blokes to go and do that as well. You know, it's always, most of these things come under the clinical banner. We've got to go into the white coats to talk about it, and they're not as easy to access for blokes as well, I reckon.
Absolutely. So testicular cancer, it's been around for a long time, and we tend to think it's a young man's disease or a young man's issue, but, you know, the average age of blokes getting testicular cancer is 32 years of age, and we've just recently been dealing and chatting with a guy who was 78 that got diagnosed with testicular cancer. So what are the actual things we should be looking at, Glenn?
Yeah, so obviously a swelling or lumps, and that can come back to, or can be helped by doing some self-examination. And as much as we sort of joke and laugh about it, that doesn't happen when the ladies are doing the same for their breasts. So we need to get as comfortable around that, I suppose, as the ladies are with breast exams.
So Terry, on that self-examination, what do we do other than just feel our nuts? You know?
No, look, it is a test or a self-examination that's best performed after a warm bath or shower, because obviously that warm water helps relax the scrotum a bit. Don't do it after you jump out of a cold swim in the pool, mate, when they're up around your throat.
That might make your eyes water, mate.
Yeah, well, look, it is about feeling, obviously, your testes between your finger and thumb. And like you say, Owen, don't use the points of your fingers or your fingernails, or your eyes will water a bit. And look, it's not unusual to have one testy slightly larger than the other, or one to hang a little bit lower. But it is just feeling for abnormal lumps or bumps or little hard bits of gravel. You need to check each testy individually, but also being aware of the epididymis, you know, so that soft tube-like structure which is at the back of the testes that stores and transports the sperm. So just being familiar with your bits and really looking out for any changes, because it is the second most common cancer in men aged between 18 and 39. You know, about 700 cases diagnosed of testicular cancer a year, but it is quite easily to treat, and more than 75% of men are cured when it's picked up early.
So we go to risk factors, Glenn, because it's important that we do talk about risk factors with a whole lot of other things, but testicular cancer, it's important as well.
Yeah, so some of the things that are listed as risk factors are things like having undescended testes, a previous testicular cancer makes you more prone to it. Previous male infertility can also be a risk factor, and a family history, which is so often the case that when we talk about all sorts of health issues, we talk about things we can do. I suppose a family history is not something that we can actively remove, but we need to be aware of it so that we know if we're more at risk, just as we do with high cholesterol and things like that.
Yeah, and quite a bit like we spoke about prostate cancer, you know, quite often there's no symptoms until it is there or advanced, you know, so, and there's not always pain is present, but I've had guys talk about that pain in the lower abdomen, like a low ache or dull pain, abdomen, groin, even the lower back, but definitely, any major changes or that heaviness in the scrotum. And we've had some stories, haven't we, about blokes at bars joking about the size of their nuts and making light of it when it's some pretty significant issues they should have had checked out.
Oh, and true stories, Terry, about blokes sitting at the bar with a big nut and drinking beer all night, winning the award for having the biggest nut. And, it's something that we need to deal with. And I guess it's still predominantly, the young men between 20 and 40 at risk. And it can happen to anyone, but we just got to bear that in mind as well. And whilst we're not going to go into the options to treat it, the surgery, the radio, the chemo, there's a heap of options, but the key to testicular cancer, like all other cancers, is early detection, and then we can get 99.9% curability out of it, which is just really important.
Yep.
So I guess that leads us into the next component of men's sexual wellbeing around infertility. And, quite often as blokes, we think that's a ladies' issue and, in terms of conceiving and what have you. But the research tells us otherwise. And whilst there's no reproduction signs or no signs with our reproduction capacity, we still need to check in on a few of those factors.
Look, I think you're right, Owen. Often men can be shocked to be told that they're sort of half the problem as to why a couple may not be able to have a baby at the end of the day. But look, infertility can have many causes, and it's usually based around the quality and the quantity of the sperm. Sometimes treatment can restore natural fertility, but there may be other things going on there as well, Dunco.
Yeah, so one of the things that you could look at is actually virtually the mechanical side of things is the importance of ejaculation. If you don't use it, you lose it for prostate health and for fertility. 2 out of 3 men have sperm production problems. There can be blockages of the sperm flow.
I guess out of all that, Glenn, is that infertility, we can be in sync with our own body, but the research out of infertility in couples is that males contribute to half of all the cases in infertility. So that's just a really important benchmark that we've got to roll, because as my preface, my earlier comment, that we just think it's ladies, or quite often a young bloke will say, and there's plenty of cases that I've been involved with where the male has gone in and joined in the conversation and it's been us, and a pregnancy happens.
Yep, no, historically the focus has been on mother and child, and I think in those early days, infertility was quite often focused or blamed around the woman's reproductive system, but a lot of the evidence obviously now points to that. And just us blokes being aware of definitely those family histories, some of those risk factors we spoke about, number, quantity, quality, things around our ejaculation, and we will touch on later around STIs, but even that untreated or undealt with STIs can cause that scar tissue and problems with both ejaculation and sperm production as well.
And when we're talking about infertility, I guess it leads us into the second bit, because there's the infertility which happens naturally, which we're trying to sort out why we can't have babies and for the issues we've just talked about. Then there's the infertility that we bring upon ourselves, like choosing to have a vasectomy and control our production that way. And I guess we just need to explain what that is, a vasectomy. And a fair few blokes have a vasectomy post their breeding life, because that's the whole point of it.
Basically, to define it, it's the cutting of the vas deferens, which stops the semen actually making its way out. The seminal fluid that's coming out, that's probably between 10 and 30% of semen, but so you still ejaculate, still orgasm, feel no effect on sex drive. But sometimes blokes can certainly be concerned about it, and it's really important that they engage with their GP to understand it, because we laugh and joke about it, but it's a procedure that, whilst it is a surgery and it can be invasive, when you compare it to the surgical procedure perhaps for the ladies, it's actually a little bit less invasive. Yeah,
and that's a good point too, because once again, historically, birth control has been the realm of women and the range of options women have, but definitely an important little tool to throw into any conversation. Once obviously couples have done with their families and want to still have a healthy sexual relationship, it's something us blokes can have some control over and be part of that birth control method.
Absolutely, Terry, and I guess we're 100% here because Glenn and myself had vasectomies many years ago. In my case, many years ago, and it didn't affect the sex drive. It worked, even though I didn't get it checked that it worked. But it worked because we proved that.
Should we check with the wife on some of those facts, mate?
So it is. There's a lot of literature around about it, but it's a legitimate thing to do and participate in that family planning.
I suppose the thing is too that a lot of people worry about side effects, and the thing is the side effects are usually very minimal. They can range from a little bit of swelling or bruising. There's epididymitis, and there's also the chance of a little bit of infection on the site, but they're all super rare. And other than my daughter jumping off the back of the couch onto my lap the night of the the night after the procedure, I probably didn't have too much in the way of pain. I just don't ride your bike home from the surgery. It's probably a good tip.
That's right, Glenn. And I think just having that conversation with your partner about it or your wife about it is just that really important important bit. And as for the surgical options, it is really simple. You can choose to do it in this day and age without being knocked out. I was a sook, so I chose to be knocked out because I didn't want to see what was going on, just waking up with some sore nuts, and that was pretty simple.
I suppose the other thing to keep in mind too is to treat the decision as if it's final, though keeping in mind the fact that vasectomy reversal is actually something that can be done, but you should treat vasectomy as final. The success of a reversal drops pretty markedly after 10 to 15 years, but prior to that it can be successful between 60 and 90%. Once again, it's a decision that needs to be made between you and your partner. So I've had the vasectomy reversal, and then the vasectomy again. And I tell you what, after the third time, the scar tissue down there, it felt like they were doing the procedure with a blunt butter knife. But
hey, you're not Irish by any chance? To be sure, Glenn.
to be sure.
No, look, that's good. So I guess the other thing too, we just want to talk about testosterone deficiency because it's the most important male sex hormone in men, and sperm and testosterone are made in the testicles. So it's important to care for them to protect your reproductive health. So we do have to, like we've been talking, look after our testicles and keep a check and be conversant with the things that we can do to increase our fertility and look after them. So the role of testosterone is really important, Glenn. It's just the number one.
It's a bit of that.
The number one chemical.
Yeah, it's the most important male sex hormone for men. And it's got that key role in reproductive and sexual function. It can also impact things like muscle gain and stuff like that. So as that drops away, as you get older, that can have an effect on your exercising routine and how you feel about yourself. And it's one of the physical attributes of male puberty and in adult men.
Yeah, no, look, and that testosterone deficiency can affect men of all ages, can be caused by genetic or medical problems, damage to the testes. But also I think we've got to remember, like we've spoken about in the past, that sexual dysfunction can decline as we get older. So we do are aware of women with their estrogen levels going through menopause. There's that sudden drop off the cliff of the estrogen levels. But for blokes, it's a bit more gradual, that testosterone decline. So obviously peaks in our early 20s. We're like bloody raging bulls, aren't we? But they talk about that testosterone level depletes about 10% every 10 years. So we will get to an age and a stage eventually where it can naturally deplete. So really important to remember things that help boost and restore testosterone just around general well-being. Things like sleep, exercise, even in light and moderate weight programs are good.
Yeah, we talk about those things, Terry, like it peaks between 20 and 30, falls by a third between 30 and 80. And while it says no specific symptoms, we need to do a blood test to get it diagnosed. And we just need to be aware that there's two fluctuations. There's fluctuation in testosterone in a 24-hour cycle in our life, as well as over age. So that's why we say in that 24-hour cycle, it's all right to have a bit of cave time get home from work or get home from what you're doing, and some blokes just crash, and do nothing, and that's to allow that replenishment. But that stuff over time is really important, and through our work we've picked up a number of blokes, one in particular that was diagnosed with a mental health issue, but it wasn't a mental health issue after about a year when they got to the bottom of it, and it was a testosterone deficiency, a significant one. He went on to injections. They solved that problem. There was no mental health issues, and back to fully 100% productive person in society. So it is, we've just got to be aware of it, and the fact that 1 in 200 men can suffer from low, given that it naturally declines over our age. So, yeah, look, there's a lot of literature on it, and it is a very specific thing with our ageing, and I still reckon we don't attribute enough of that to male menopause and what happens to us in our later stages of life.
No, but definitely things around that, sudden changes in mood, low mood, that irritability, but also, like you said, those physical changes around loss of libido, loss of that muscle tone. So once again, that reminder for us blokes just to be aware of those little changes to our body and getting on top of it.
And you'd look at the difference between how society there's a real acknowledgement of female menopause and the impacts that it has on their life. And because blokes are as they are, when the discussion comes around a tailing off of testosterone and how they feel about themselves, it kind of gets brushed under the carpet a little bit because it's seen as a taboo subject.
Well, not only individual lives, but we're talking about relationships, about two people working together in harmony, and that effect of both menopause and menopause on those relationships we've had. It's a common issue for that to cause a bit of a fracture in relationships.
I reckon a real significant issue, Terry, in later life, partners splitting up that might have been married for 30 or 40 or 50 years, and it's one of those big causation factors of growing apart, and we need to confront it and talk about it a whole lot more than we do. Yeah, I just wanted to throw to you, Glenn, with your personal experience on STIs, and
Subarus. I was involved with rallying, so
So to finish off, we really just need to mention STIs. We won't go into a big way, but they have kind of come back into the conversation. Not that they ever went anywhere, and there's some specific areas in the state as well as a pretty steady rate of STIs in our community, and we need to be talking about it more.
I think it was quite successfully knocked on the head for quite a few years following.
Excuse the pun.
over the AIDS epidemic years ago, and that whole push to wearing condoms both in heterosexual and homosexual sex. But there was a real push for that to happen, and it carried over into to everyone basically. But since that has died off, I know what you're talking about. We previously did a discussion in prison where we were talking about an epidemic basically of STIs amongst certain communities in WA.
Yep.
Yeah. Well, when I was a young fellow, they were referred to as STDs, and I thought that was about making a long-distance phone call.
You can get it in a phone box.
So, look, STIs, sexually transmitted infections, caused by germs getting inside you when you have sex with someone who has the infection. So, and that includes all types of both vaginal, anal or oral sex, and obviously the best thing you can do to avoid it is abstinence, or having a committed relationship with one partner. But look, if you are having multiple partners, the most important thing is to wear a condom. When on heat, package your meat, as they say.
If it's not on, it's not on.
Yeah, that's exactly right. And we just have to talk about it, and it needs to be put back.
Yeah, definitely. And look, once again, there can be anything from no signs of an STI all the way to some pretty scary stuff going on down there with infection, pain and pus and all sorts of pretty unpleasant stuff. So people can be quite embarrassed and avoid seeking help. But look, if you are or have had unprotected sex, just go in for a test. It's usually as simple as doing a bit of a pee in a cup, and then getting some antibiotics or some medication if they pick up anything as a starting point. Yeah.
So I guess in summary of even the last 3 podcasts, but especially today, is what can be done. And I guess by having a conversation is we're just encouraging men to talk about sexual well-being, which will assist us, to seek treatment and support, because it still is a taboo subject, and one of the recent below the belt studies backs that up, that it's hard to talk about. So we haven't eased up on that, and we usually wait until we're something's gone wrong before having that upfront conversation. So really important to talk to both your partner and your doctor and just communicate.
Yeah, and I think still coming back to that, like you said, Owen, that warrior attitude of us blokes that, it won't happen to me, or she'll be right, or I'm too embarrassed to talk about that. I think we've just got to be honest with ourselves, with our partners, and once again, the research shows with all the majority of these things, if picked up early, a lot easier to treat than once they become bloody chronic issues in our physical health, mental health, or with our relationship breakdown. And
just to repeat a few things I'll get you guys to talk about, but we've just got to reiterate again, which we've talked about through these podcasts, is men's sexual well-being is holistic, and it doesn't matter whether I'm got a partner or I'm a bachelor, we've still got the bits as a bloke. So that men's sexual well-being encompasses all of us as blokes in our life. So we have to be alert to those body physiological changes and we've got those bits, so we've got to bloody be proactive in doing something about it.
No, exactly right. Going back to our very first podcast in this series, quite often blokes associate it with, whether I'm getting a root or not, but all those bits that make us a man. So, look, being aware of your body, talking to your partner is essential. As you say, if you're a bachelor, you may not have that partner or someone to give you a tap on the shoulder, but going in for those other health checks or doing some of those self-examinations we've spoken about. Definitely having a chat to your doctor about risk factors. Once again, we spoke about sexual dysfunction can increase, obviously, with men over 50 years of age, but we've spoken about things like STIs and testicular cancer that impact young men as well. As we've said before, sexual dysfunction can be a sign of other diseases. So that holistic health and well-being and keeping a check on things, diabetes, cardiovascular health.
Yeah, and so on top of that, exercise and looking after yourself for that just general well-being, it also impacts our sexual well-being. And good sexual well-being is vital for our overall well-being and health, and we need to acknowledge that it is an important part of the whole bloke that we are.
Absolutely. Righto, well, take care in podcast land out there, and think about your sexual well-being and act on anything that's out of the ordinary. And we'll catch up with you soon with the next podcast.
Our health is our responsibility, Owen. No one's going to do it for us, so it is up to us. So, yeah, definitely take care of yourselves, and thanks for your time today, guys.
Thank you.
Cheers.
Talk to a mate. Just let him know you're there. Talk to me, mate. Oh.
Thank you for listening to our Working with Warriors podcast series.